Welcome back to the Salon Chat. Be sure to take a look at our very first video on this series of hair loss with Jacqueline Tarrant from a trichologist perspective. In this video, it's part 2. We take a deep dive in hair loss as it relates to the hairstylist and the consumer. Let's take a look.
I'm going to look at 50 to 100 to 150 strands, which is the normal amount of hair shed per day.
When the client actually starts to see those signs of that little bump and, the itching and the little pain in that area, what would you recommend hairstylists do? Because we might have newbie hairstylists watching this and also seasoned hairstylists watching this. And a lot of newbie hairstylists right out of school, say 5-10 years, a lot of their clients are going to be basically the same age they are.
Right.
So some are not really going to be able to experience some of the things that we might see in clients that are a little older.
Sure.
But then you have a lot of younger consumers that are getting these wigs and extensions and are experiencing it at a younger age.
Yes.
So what would you recommend with any of those types of hair losses that you mentioned? What would you recommend some steps for hairstylists to take to see that their clients are experiencing any of those?
As a beauty professional behind the chair, you have a client that's been coming to you for a while, or if it's a new client, or someone that's coming to you for a one-time service, the first thing that I always recommend is to examine the scalp. And if you see any areas of the scalp that are showing hair loss, hair thinning, in other words, it looks thinner in that area than the rest of the head. There are different densities of hair naturally. There's the numbers of hairs per square inch, and that's what we're talking about right now. So when you're looking at that and you notice an area that seems thinner, or you see a bald spot or a clean area or a very sparse area, bring it to the attention of the client to let them understand what is going on. Sometimes they can give you a lot of background information to help you to understand why this is here, what has happened, what has gone on. If they are looking to you as for information or recommendations of what to do, you want to utilize some of the tools that you can use. You don't have to be a trichologist, but what you will want to do is, if it's some type of styling practice that's too tight, that may be driving the process, you want to change up the style. You want to change up the look so that abusive practice, whatever it is, if it's too tight, and too tight is relative. What's too tight for one person may not bother the next person. But you have to look at what you're seeing in front of you and make some changes. Shift the way that the hair is being styled. Shift the tightness, release some of the tightness. Maybe have the hair redone or replaced in shorter periods of time, so as not to expect it to last past 3 months, 4 months, and so on. If you see bumping on the scalp, you want to immediately release any tightness there, because that's a true sign of inflammation. You want to begin by using an anti-inflammatory shampoo. You want something that's anti-inflammatory. Sometimes some of the hair that's being used for some of the braiding or the crocheting practices, sometimes it creates a fungal situation with the consumer. Some people are starting to have allergic reactions to the hair. So you want to remove the type of hair or the tightness of the style. That's step one. And as a treatment regimen, as I mentioned, you want to use an anti-inflammatory shampoo an antifungal shampoo, something that creates a healthy scalp, because a healthy scalp will give you healthy hair. And those things will dramatically improve the condition that the hair and the scalp are dealing with. Also, talk to the client. Has this area been itching? Has it been burning? Are you feeling discomfort? If so, when do you notice? If someone comes to you and they say, oh, I noticed it seems like my hair, I'm losing a lot of hair over the last couple of weeks. You can't just take that and dismiss it, or you can't just take that as all that there is. What I like to do is to have the client, if they're going to return to me in 7 or 14 days, have them have 7 to 14 little clear baggies and label each one for each day and collect hair for each day of shed that they are experiencing. Because I want to understand, is this normal shedding and you're noticing it now more than ever, or is this excessive shedding? So when I look at the head of hair, I see the number of hairs per square inch. I get a sense of, is this hair thick, medium, or naturally. Some people just naturally don't have a lot of hairs per square inch, and the texture of the hair may be fine. So I'm going to look at 50 to 100 to 150 strands, which is the normal amount of hair shed per day. And I'm going to examine the baggies when she brings them back to me. That gives me a sense of, is this really more hair than there should be? Or are we just becoming a little hypersensitive to the noticing of the hair? As a stylist, you not only are focusing on your creative abilities, but you're an investigator. You're constantly trying to figure things out. What has been going on? What has happened before the person came to you? What has happened since they left you? There are certain things that when you sort of travel that path, it shows two things. It will give you some results. It will also help the client to understand she really cares and she's really focused on my well-being. Also, after you have made your determination of the experiencing irritation or itchiness or bumping or burning, which sometimes is contact dermatitis, which can come along with some of the hair that's being used. Sometimes people are reusing hair. Sometimes the hair has parasites in it, I'm sorry to say. Sometimes you have, the hair has not been properly cleansed before you put it in your scalp or on your head. So each one of these things can create a different scenario. So we have our camera phones now. Take a picture. Capture that as your part of your record of what's going on with the individual. And then sometimes, if this condition is not improving, along with your anti-inflammatory shampoos and your antifungal ointments or things like that sometimes you might want to take the natural approach, it may be time to make a recommendation to a dermatologist with a specialty in hair loss and someone who understands ethnic hair care practices. We happen to be fortunate enough to have a very good friend, Dr. Victoria Barbosa, who is amazing at these different things. She and I worked together at L'Oreal, and she is my person. Like they say, everybody has their person. She's my person. She's my go-to when it comes to, okay, I see some things that I can't write a prescription for this because I don't write prescriptions. I identify, I do natural treatments, I can do laser hair care treatments, but there's some things that only the dermatologist can do, and she and I can work together to get this client to a better place. Maybe have an antibiotic, because if it's contact dermatitis, some type of bacteria or microbial thing has gone into the scalp. If you scratch your scalp and break the skin, and any type of infection touches that open spot, when that skin goes through its natural process of healing, it takes that bacteria inside the scalp with it. Now, that could contribute to itching, burning, and that itching, when it's out of control, sometimes people actually scratch a bald spot. Mm-hmm. It's just so, they just can't, it's just unmanageable. And an oral antibiotic that the doctor can prescribe, along with a topical ointment that is antifungal, can really change a person's life. Yeah. But all these things are progressive if you don't address them. They're things that we should know when to make that recommendation to level up to the next level. And that is valuable to alleviating hair loss overall. So we've done our due diligence with identifying a problem. We've asked the client to do homework, as in, if it starts itching, let's see when it's itching. Is this when someone stresses you? Someone angers you? And you immediately feel that situation? Is it stress at work? You're trying to meet a deadline? Or is it just continual? See, all of these little things identify something different. And alopecia, of course, is the overall terminology for hair loss or balding or bald spots, but there are many, 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 many causes of hair loss. Side effect of medications. If your iron levels are low, a lot of the ladies that I see, African American women, deal a lot with fibroids, and that causes excessive bleeding when it's that time of the month, and that can cause your iron levels to be low. Low iron levels then create a diffuse thinning. So not just in one spot, but the entire head will begin to shed and lose hair. Correcting that situation can turn that around. So sometimes it's that. Sometimes it's your thyroid, which is another hormone that is out of balance, hyper or hypo. Each one can have an impact on the hair. Hair is fed directly from the blood circulation. So everything that's going on in your body, your hair is a barometer to tell you something is out of order.
That was an entire lesson for hairstylists.
Yeah, I tried to include the things that I thought could be helpful.
Yeah, that's very helpful.
Yeah.
So from a consumer's perspective, say for instance, you have a consumer or a client who is not getting that lesson from their hairstylist, what would their steps be to take?
Yes. So as a consumer, if you are experiencing any of the things that I've mentioned, I don't suggest that you continue to try to self-treat. Mm-hmm. I suggest that you do see a trichologist, and now people are literally searching and Googling and searching for trichologists. And when I first started focusing exclusively on hair loss, trichology, natural hair services specifically, now 14 years here on Michigan Avenue, I have to say that there were few and far between. People didn't know what the word meant. Very few people were looking for it. But now it's coming up in the ranks. People are looking because women are paying more attention to their hair, their hair loss challenges and situations, they're really looking for someone to help them with these issues. It's just priceless when they find someone who can point them in the right direction and give them information and knowledge. But if you know that you've been wearing some of these tighter styles, anything where it's braided down and something is attached to it, if you know that you took a leave before you got your braids done so that your head wouldn't hurt because you knew it was going to hurt, actually your head is not supposed to hurt, and the hurting is telling you, that's your message. That's your body telling you, this is not what I want. And there will be some problems to come as a result of it. So, step away from some of those styles for a while and give your scalp a rest. Allow your hair to breathe. Allow your scalp to breathe. So I've had some people that come to me that they went on a progression. They started off with braids, and then they went to weaves. They might have started with the glue, and then they went to the sewing, then they went to the weave with a cap, then they with the netting, then they went to wigs, and now you're changing each time, and you're covering for longer periods of time because you are noticing that you have less hair, and you're becoming less and less comfortable with dealing with your hair. So now you're almost feeling compelled to wear a wig, and some of these things, don't get me wrong, I have no objection to it, but it's aesthetic. It's designed to be worn occasionally, but not to live your life for 5 years straight in this one way. Because when you don't allow your hair to breathe, you don't allow yourself to get used to styling your hair, you don't know what to do. And out of that frustration, you go back to the weave or the wig or whatever it is. But in your heart of hearts, you really want to come out of this thing. Now is the time. More people are working remotely. You don't have to, I'm seeing so many people, they're like, okay, I work remotely now. My job is just going to be remote. I don't have to worry about that judgment in the office or whatever the case may be. Take this time. Take this opportunity.
Yeah.
Get acquainted.
This is kind of the best time to do it.
This is the best time ever.
Because I feel like a lot of people, because I have a client in particular, she's a new client, and I'm just kind of watching her, and she only comes like once a month, but she comes to get her natural hair shampoo braided so she can put back into the wig. And I'm like, you want your hair to grow, but you gotta let your hair breathe. Yeah. And you wear this little net on, and you put this cap on. It's just like the hair follicle.
Got the layers.
Yeah, exactly. That's even worse. Right. And your hair follicle, and she has a nice texture. It's just short, but sometimes you gotta just get used to that shortness so that it can grow into the look that you want. But covering it up is not always the best choice.
Women feel powerless as it relates to them discovering what to do with their own hair when they've been in extensions for long periods of time. Everyone doesn't have a texture that is easily manageable. And sometimes it's just a matter of learning the steps. So I started doing things like, that's why I have the coaching corner, because I go through coaching sessions. Clients come to me now for one-on-one coaching to learn how to manage their natural hair, to learn how to discover whatever curl pattern they have. And your pattern is not the same as my pattern. But your pattern is beautiful for you.
Right.
And embracing it requires patience. It requires some investment. It requires some time, and it requires some repetitiveness. You know, you're from the old school where you would hear your parents say, oh, you got to train your hair. Even guys, when they're brushing in waves, they like, yeah, you got to train your hair to brush the waves in. And the more you do it, the easier it becomes. This is no different. So this is a great time for stylists, educational manuals. I have a booklet that I created that walks clients through the steps when they come in for a one-on-one coaching session to learn to identify their curls. They get a consultation. We identify their curl pattern, talk about what kind of pattern will be best for them, or what kind of technique. Is raking good for you? Is shingling good for you? Is coiling good for you? If your hair naturally coils, let's go with whatever it is that your hair will do, because it can be beautiful. But we have to be introduced to our natural hair, because for many years relaxers were being used. Yes, I used the R word. It was being used on children from very young ages. So they never got to know their hair. So now, all these years later, from if you got your first relaxer at 6 and you started going natural at 30, you've got all these years that you never really got to know your hair. And that's not a bad thing. That just is what it is. So now let's start at 30, 40, 50, 60, whatever age you are right now, and let me introduce you to your curl. Let me introduce you to the steps of creating a good conditioning foundation for your curls to thrive. You won't even see your curl until that hair is properly hydrated, and then the curl will show up. So there's so many shortcomings that each of us kind of fall into, because we fall into the desire for the quick, but the quick doesn't last. Just like your mama say, fast money don't last. You know, everybody wants what I call the microwavable situation. This is not 3-minute hair. Popcorn in 3 minutes to work at this. You're gonna have to love this. You're gonna have to invest time in this. You know, for yourself, anyone who's raised girls, it takes time when you are grooming their hair to finally get that regimen down pat. So it's no different. We're still that girl trying to groom that hair.
Right. This big girls, right?
Whatever that relationship needs to be, now is the time. Many of our issues have come as a result of frustration of not knowing what to do, so we cover it up. So how many times have you seen someone, you don't know them, but you judge them based on the way they look? That's what you're doing to your hair. Mm-hmm. You see your hair, you judge it based on the way it looks under the worst circumstances. You're not investing time in trying to get to know it. And just because something doesn't work the first time, it's taking time to get through the training process. Stick with a good conditioning regimen. Learn, go to a stylist that can help you identify your curl pattern, your condition of your hair, that can condition your hair and bring it to the right balance of protein and moisture so that your curls are just thriving. And your hair is going to respond to the environment. If it's humid or moist outside, your hair's going to respond to that. If it's dry in this dry environment, your hair is going to respond to that. What you have to learn is when this environment is present, what do I do in my reaction to counteract that result if it's undesirable so that I can get the result that I want. But you have to take time and patience to get there. And so in the coaching corner, that's the conversation that I have with clients. And I have clients that are now several years in, and they are loving the experience. It's not for everyone, because everyone is not willing to do the work. Mm-hmm. But slowly but surely, more and more are willing to do the work so that they can enjoy the hair that they have. Natural hair, even if you have some thinning issues, natural hair can cover that up because it's so full.
Mm-hmm.
There are ways to work around that.
Mm-hmm.
And as the beauty professional, that's part of my job, to identify your challenges and to give you a working plan of action that you can love. The thing they'll ask is, what did you use? But it's more to it than that.
Mm-hmm.
You know, in product development, as we first started off, that product can only give you what you, exactly, so much. It's going to only work with what you give it. But if you give it a conditioned head of hair, then that product can give you a beautiful curl pack. Just take a few minutes and learn that technique and you can do it. And as stylists, we become teachers.
Mm-hmm.
Don't be afraid, because the client will always come back. And the client will come back to that person who makes them knowledgeable, to help them to understand this is the beginning of your learning process. When we get to this point, we'll be able to get that style over there that you've been saying that your hair goal is. We don't have to automatically give people everything that they say they want, because when you're in the teaching side of the process, you have to show the person that yes, and it's possible for you. But first, we have to get these things in place first.
So lastly, Jackie, what I hear you say is for clients and hairstylists, it's merging education and a little bit of love.
Yes.
Right? It's merging education about your hair and loving your hair. And when you get those two, when those two come together and really bind together, then you can actually, like you just said, embrace and love on your curls. Love one. If it's short, if it's gray, if it's long.
That's right.
Whatever it is, even if it's a little thinner, you can still embrace
work with it.
So finally, what advice would you give once that those two things are met, the education and a little bit of love when it comes to stylists and clients, but without getting themselves overwhelmed on Google, because you mentioned that earlier, because there's so much information out there, they can get overwhelmed.
Yes.
What would you say as a last word to our listening audience, how they can begin to emerge the education and the love without being overwhelmed on Google, and just finding that professional hairstylist, all the right team that can really bring that hair to life? Correct.
So the one thing that I would say is try to find your person. That's one thing that I think can be really helpful. Secondly, if the beauty of your natural hair is once you understand it, then you can lay out a path for yourself. And if you can find your person to get you started on the right path, get that basic knowledge, because I call it YouTube University. It's out there and it's a lot of information out there, but it can be really, really confusing. So when you're looking at these various videos and things, what you want to understand is which type and texture do you have, what's your best conditioning regimen to stick with, and how you can use product and technique to get to a style that you can live with. Sometimes you have things that you can do quick, that doesn't take as much time. Maybe it's your go-to, maybe you're twisting the hair, or maybe you want to learn how to do the best wash and go for yourself. You have to try a couple of different things. But what I will tell you as a blanket response, if it hurts, it's not good for you. If it's painful, it's not going to be good for you in the long run. Please don't think that all hair is automatically going to grow back, because too many people have experienced hair loss from improper styling, and now the hair is permanently lost. So again, try to find your person, and also be patient with yourself and with your hair. And your hair everybody is not a hair person. You know, everybody can't just touch the hair and work it out and make it look great. But then some people are really good at it. I mean, I'm amazed at what I see some people do. But it's about trial and error, seeing how your hair responds positively. And with your younger children, please observe. Are they getting those bumps around the edges? Because that's usually where I see it first. I see the babies with the tight braids, and I see the bumping, and you see them in the grocery store, and they're scratching. And they're scratching because that infection is creating that itchy experience for them. And I've walked up to moms, and hopefully she'll take it the right way. I'll try to approach it being kind and talking to the child, and I kind of pointed out to her, and 9 times out of 10 they're like, oh, I didn't realize, thank you so much. Okay, so we're going to make some changes, because people do want to know. Mm-hmm. You know, sometimes we feel like we don't know how people are going to react, but I always have to stand on the side of what's right. And as a beauty professional, I don't put money or how much I'm going to make ahead of, is this a healthy service? A lot of times I have to say no. And I tell them, I'm going to be the bad cop today. I have to tell you, no, that's not a good style for you, because we're just getting through this, growing these edges back. And if you do that same style again, you know, just calling it something else, you're going to get the hair loss.
Right.
And people appreciate that.
Yeah, they do.
They really.
It's hard for them to take this. You know, you're taking them out of their comfort zone.
Yes, but also have something to introduce them to that they can live with.
Right.
So I'm always challenged when I know that I'm going to take them out of the comfort zone. Okay, so that's what I have to have, not just identify the problem, but also come with a solution in the same breath.
Right.
But what I would like for us to try is this. Let's give this a try and see how it works.
Right.
And people respect you for that. They really, really will.
Right.
They will love you. They will never forget your turning down something that could have been quick cash for a long-term act of love that will keep that client coming back to you, and knowing that that person has had an experience 2 and 3 years down the road that has turned their life all the way around. And I have so many of those types of clients, and I'm so excited about it.
So if you are a hairstylist, what are your questions about hair loss as it relates to your clients in the salon? Comment down below and let us know.